My name is Dr. Adam Farber, and I would like to present to you a video demonstrating an arthroscopic anterior labral repair in the shoulder. In order to understand this video, you must first understand basic shoulder anatomy. The shoulder is a ball and socket joint. The top of the arm or humerus is called the humeral head and comprises the ball of the ball and socket joint. The socket, also known as the glenoid fossa, is a portion of the shoulder blade or scapula. The glenoid is surrounded by a ring of soft tissue called the labrum. The labrum helps to deepen the socket and provide a bumper which aids in stabilizing the humeral head, preventing it from sliding out of the socket. Furthermore, the labrum, shown here by the yellow ring, serves as an attachment site for many of the ligaments which help to stabilize the shoulder. When a patient dislocates their shoulder, the ball comes out of the socket and the labrum tears away from the glenoid. There is a characteristic labral tear in the front portion of the shoulder known as a Bankart lesion. Surgery to repair the labrum begins with diagnostic evaluation of the shoulder joint. Here you can see the glenoid on the left, the labrum in the middle, and the humeral head on the right. There is fraying of the labrum shown below here. This diagram dictates the anatomy that is pertinent in this portion of the shoulder. The humeral head is on the right, the glenoid on the left, and the frayed labrum in between. The frayed labrum is enclosed in the green circle. Next, the arthroscope is placed in the back of the shoulder, and first the labrum posteriorly is viewed as seen on the right. On the left here is the displaced labral tear in the front portion of the shoulder. The labrum is on the left, the humeral head is on top, and the glenoid is on the right portion of the monitor. Again, here is a diagram demonstrating the pertinent structures for orientation purposes. The labrum is on the left, the glenoid is on the right, and the humeral head is on top. An arthroscopic probe is used to probe the anterior portion of the labrum, which is easily displaceable away from the glenoid bone. Next, an arthroscopic elevator device is used to detach the scar tissue that is holding the labrum onto the socket. Mobilizing the labrum in this manner is important because it allows the surgeon to retension the ligaments when the repair is performed and therefore provide appropriate stability to the shoulder joint. Next, a shaving device is inserted into the shoulder joint at the site of the tear to scrape up the edge of the glenoid bone and remove residual scar tissue. After the scar tissue is released and the bone is repaired, you can see how mobile the labrum is. Next, anchors are inserted onto the rim of the glenoid bone and used to secure the labrum back onto the bony socket. The anchor is inserted through this metallic guide. After the guide is removed, you can see the two blue and white sutures which are used to secure the labrum onto the glenoid rim. Next, using this retriever device, one of these sutures is pulled back out of the shoulder joint where a wire has been previously passed around the labrum. The suture is grasped here and pulled out the back of the shoulder joint. The wire shown on the bottom of the monitor is pulled and used to shuttle the suture around the labrum. Here the suture is now around the labrum. Next, an arthroscopic knot is tied to secure the labrum back onto the glenoid rim to tension the ligaments, providing stability to the shoulder joint. Here you can see the knot slid down to compress the labrum onto the bone. Additional knots are then tied to increase the knot security. The excess suture limbs are then cut with an arthroscopic cutting device. The process is then repeated to repair the remainder of the torn and detached labrum. Again, using the drill guide, another anchor is inserted just above the previously placed anchor onto the edge of the glenoid bone. There are the two blue and white sutures. One of the sutures is then retrieved out of the back of the shoulder and placed here temporarily. Next, a lasso device is used to grasp ligament, shown here, and labrum, and will be used to shuttle the suture around the labrum to secure the labral repair. A loop of wire is passed out of the lasso device and retrieved out the back of the shoulder joint. And used to shuttle the previously placed suture there around the labrum. Here the suture is seen around the labrum. Next, another arthroscopic knot is tied to secure the ligament and labrum back onto the rim of the glenoid bone. Here the knot is shown, and as it is tensioned, the labrum and ligament are reduced to the edge of the glenoid. Again, additional half-hitch knots are passed to increase knot security, and the excess suture limbs are then cut with a suture cutting device, as is seen here. The upper portion of the labrum is then repaired in a similar fashion with a third anchor device. After all three anchors are inserted, you can see the labral repair is stable and firmly opposed to the glenoid rim. The probe is unable to displace the labrum away from the bony socket. The camera is then positioned in the back of the shoulder for a more panoramic view of the completed labral repair. Here is the back of the labrum and the front of the labrum in the area of the repair. You can see the three sutures used to secure the labral repair. Again, the probe is unable to pull the labrum away from the bone, signifying a firm and stable repair. Here is a photograph showing the detached labral tear on the left and the same area after the repair has been completed on the right. This completes the arthroscopic labral repair surgery in the shoulder. Thank you for your attention.